certainly we're always concerned when we see new variants, and we know that this is something typical that we see through the evolution of the virus. But I think one of the most important things to point out is that, we know we have the tools to decrease the spread of COVID, and the best way to prevent the new variants coming and taking hold is to decrease the spread of what's here already. So that means, of course, getting vaccinated if you're old enough to be eligible, wearing masks when you're in high-risk situations like indoor public places, making sure that you don't go out and about while you're sick. All these things that we know how to do to decrease the spread of any variant, that will help us decrease the spread of any new variants as well.
So we're talking about the vaccines. Tell me what you're hearing in terms of the timeline for their approval for children. I have an 8-month-old daughter, and it's unclear to me how much at risk she is because of how young she is, but also whether she is somebody who would be eligible at any time soon for a vaccine.
Yeah, it's a great question. And I think it's one that parents and pediatricians across the country really are eager to know. I think we know a couple things. We know that it is likely that there's going to be data from one of our manufacturers submitted to the FDA, probably sometime this month is what we're hearing. And so I think that could put us on a path to be authorized. We've heard as early as Halloween and as late as 2031, as late as early in 2022, rather. And so I think, we really, think this should be approached with great urgency. As you point out, younger children are less at risk for severe illness, but they still can get very ill. And so we want to make sure that we use all the tools at our disposal to help keep everyone healthy and well.
And on that note, a lot of children's hospitals say that COVID patients are putting an unprecedented strain on facilities and staff. How can that stress be relieved?
Well, the most important thing we can do, and just like in the adult surge, we're seeing these surges in pediatrics as well. Our children's hospitals are full. We have kids waiting for beds. Our ICUs are full. Children are having to get transferred to other hospitals. And so the most important thing that each one of us can do is do the things we can do to help decrease the spread of COVID. So again, I'll say it over and over. Get vaccinated if you're old enough. If you're 12 and older, get vaccinated. Wear a mask if you're in these high-risk situations, because by working together, we can help decrease the spread of COVID in the community. And I think, again, it's important to emphasize, back to your earlier point, our little ones who are younger than 12 aren't yet eligible to be vaccinated. And so it really is on us as adults to help make sure that they stay healthy.
Do you think 3 doses will likely be the new standard, as Dr. Fauci is saying?
I think it's a great question. I think there's a high likelihood of that. But as with everything during the pandemic, this is a new and novel pandemic, and so we really have to follow the data. We have to follow the evidence, and I think I for one just feel incredibly grateful that we're actually in a place where we're even having this conversation, that there is a safe and effective vaccine that is available to us, and the discussions that we're having are how do we best protect ourselves and not when will a vaccine come.
Yeah. Doctor, thank you for your time tonight. We do appreciate it.